I washed my hands. I'm going to introduce myself. My name's Vina. I'm your nurse. I'm going to do your postpartum assessment. I'm going to put my gloves on, identify my patient. Can you tell me your name and your birthday?
Christina Harrison, 8/11/87.
I'm going to make sure it matches her bracelets, which it does. I'm going to elevate my bed to a good working level. Put the head of the bed down flat. I'm going to tell you that I already done my med-surg assessment, and it is all within normal limits. I'm going to assess your breast. So they're soft and full. The nipples are not dry, and they're not cracked. And then I'm going to assess your abdomen. You got a C-section 2 days ago. The incision is clean, dry, and intact. I'm going to listen to your bowel sounds. And they're active in all 4 quadrants. I am going to assess your fundus. So, I'm going to support her uterus with one hand and assess the fundus with the other. It should be 2 finger lengths down from the umbilicus, which it is. I am going to palpate her abdomen. Ask her, when was your last bowel movement?
This morning.
And was that normal for you?
Yes.
Okay, I'm going to try to palpate her bladders, which I cannot. When was the last time that you voided?
A couple hours ago.
Was that normal?
Yes.
There's no burning, no, it's like nothing. Okay.
No.
Then I'm going to check her lochia. She's 2 days postpartum, so she has a moderate amount of rubra. It's a good time to tell you that if your rubra should go from rubra to serosa to alba, and if it ever goes from alba or serosa back to rubra, you need to contact your provider. I'm going to deglove, wash my hands, put new gloves on. I'm going to assess her extremities, look for redness, warmth, swelling. She has none of that. So I'm going to assess her pulses. I will check her popliteal pulses, her posterior tibial pulses, her pedal pulses. Those are all present, strong, and equal bilaterally. I'm going to ask her to roll over. I'm going to check her back. What I'm looking for is her epidural or her spinal. Look for like any leakage, bruising, redness. There is none of that. If she has hemorrhoids, I need to note the size and the amount, and if she had an episiotomy, I would go ahead and assess that. Okay, you can roll back over. I was going to tell you, if you are breastfeeding, you know, you wear the supportive bra, and if you're bottle feeding tight, 3 warning signs that you need to contact your provider would be if your rubra goes from alba back to rubra, a temp greater than 100.4, or any type of change in pain, like if your pain goes from mild to severe, you need to contact your provider and your incision. With your baby, if it starts running a fever greater than 100.4, 2 or more watery stools, or if it refuses 2 or more consecutive feeds, you need to contact the provider. Also, do you have a car seat?
Mm-hmm.
Is it new?
Yes.
Okay, if it's not new, then you need to know the expiration date and if it's ever been in a car accident. Also, it's okay to get frustrated. It's okay to need a break. So if you ever get like that, you can, lay your baby down and call someone and just take a break. Also, it's important that when you put your baby to sleep, you put it on its back, no blankets and no stuffed animals. That helps reduce SIDS. So do you want me to go get your baby from the nursery so I can teach you how to do your bulb syringe?
Yes.
Okay, so then I go get the baby. And with the bulb syringe, what you do is you push all the air out of it, and you would go into the left cheek and then release the air. You pull it out and you get rid of the secretions. You do the right cheek, suck it out, remove it, get rid of the secretions, and then you do your left nair, suck it out, get rid of the secretions, and then do the right. Okay. That's it. Put the head of bed down. Lowest position locked. Call bell in reach. Head of bed elevated.